Hi, this is Dr. David Samimi, and I wanted to put this video together to answer some commonly asked questions about facelifting with me. And so in this video, I'm going to talk about, number one, why choose me to be your facelift surgeon? Number two, discuss some of the common adjunctive procedures that we can do to achieve the best results possible. Number three, we're going to talk about the actual placement of the incisions and the healing process of the skin. Then we're going to go over the preparations that most people can do to optimize the results of the procedure. We're going to discuss common risks of facelifting and then go over what to expect in the healing process. Let's talk about the value that I bring as a facelift surgeon to my patients. And first of all, it's good to think about what the goals are that we're trying to achieve. And in everything that I'm always trying to do, my guiding light is really getting results where patients look like themselves, they look natural, they get a robust and long-lasting lift, and they don't look done. And we have really mastered that as experts in the upper face and around the eyes, which is really the most challenging and delicate area to master. And so I'm very excited that I get to bring those same attention to detail and skill to the rest of the face, which is something that most facelift surgeons can't do. And so being able to really control and deliver those results top to bottom is something that's special that Eyesthetica is able to offer. Every facelift is not created the same. And I'm hoping that by you listening to this, you're hopefully doing your homework and looking into the different types of facelifts there are, because the majority of them still to this day, unfortunately, they don't look that natural. And let's get into what makes the revitalized extended deep plane facelift that I do different. Most facelifts, an incision is made around the ears and the skin is kind of separated. And then the muscles that are responsible for the jowls and the loose neck, which is what a facelift is really good at improving, if it's done well, the muscles are kind of just pulled or stitched in one direction, and the skin is usually pulled back in another direction. Now, the problem is the face then has been kind of separated and the skin looks pulled and windswept, and you can usually end up seeing, some weird puckering, or the smile looks weird, and people can look like they're in kind of a wind tunnel. And that happens because the skin's been separated. The skin does not have its blood supply because it's been dissected kind of far. And so it leaves patients with that unnatural look, and oftentimes the scarring itself is really not that great because there's tension on the skin and the skin has been separated. So in the deep plane approach, which is a more advanced facelift, the skin is only dissected a few centimeters out, and then we leave the skin connected to that superficial muscle system and we go underneath it. And that way, the muscle itself is used to do the restoring and lifting, and the skin comes along with it. In the revitalized extended lift, we also release the ligaments that are tethering that muscle so that that muscle itself is just very nicely and gracefully getting moved back up vertically to improve the jowls, and then moved back up here to improve the neck. And so that difference of leaving the skin connected to the muscle, going underneath and releasing the muscle, is how we get these results where patients don't look pulled, they don't look stretched, and the incisions heal for the most part not visible compared with most facelifting. Now let's talk specifically about the incisions. So the incisions are generally hidden right here, kind of in front of the sideburn, along the contours of the ear, and then behind and around, and designed in a way where the actual ear is covering it. Now, in women, this is much easier to kind of camouflage, even in the immediate post-op period, because there's generally longer hair here and hair in the back. In men, it's not as easy to have it so you don't see it. However, when you use these approaches, the skin heals so well and there's no tension, and my male patients are able to obviously go about their lives in the world without the appearance of noticeable scars. The other place where we make an incision is right here underneath the chin. And so with that incision here, we're able to go kind of into the neck and really tighten the muscle centrally that gives you the turkey neck. And then from the back, we're able to kind of resuspend and pull. And so that combination of restoring the sagging of the muscle here vertically through the incision here, and then tightening the muscle here and resuspending it here is what gives people a tighter jawline and kind of a tighter neck, but without it looking pulled or stretched, because it's not pulled or stretched. We've gone in that extended deep plane, we've released the ligaments, and we've just resuspended the tissue to where it should be, where it was a few years back. Patients commonly ask me what other adjunctive or additional kind of procedures can be done to elevate the result as much as possible while still maintaining a natural, safe, and robust look. And so I'm really excited about the other tools in my tool belt other than just the revitalized facelift. At the same time, oftentimes patients will consider doing upper and lower eyelid blepharoplasty. This is to improve, bags beneath the eyes, loose skin, saggy skin here. Oftentimes, I will combine a small, minimally invasive brow lift to help kind of lift the upper face. And then the icing on the cake for me, one of the things that I'm an expert at and really allows me to deliver results that are just out of this world, is the restore component of this lift, which is bringing back the hollowing that usually is happening on the upper part of the face with fat grafting. And this is a procedure where I use your own body as a natural filler to harvest a little bit of your own fat and use it to restore the lost volume around the eyes. And so when you put that all together, we are able to then kind of bring the face back into its three-dimensional, youthful shape that looks so natural, which is kind of more of a heart shape. It is restored cheekbones, eyebrows that aren't kind of saggy and droopy, and temples that are sunken in. So we kind of add a little bit of volume there. And then the revitalized neck lift slims the lower face. And so it brings the face back into a beautiful, harmonious shape and proportions, as you can see in these before and after pictures. This procedure is typically performed in a surgery center. This is outpatient, where you come in and you go home the same day. Most people are lightly put to sleep, where you're breathing on your own, but not kind of awake. Others prefer to do the procedure where it's kind of a twilight, where you're kind of awake, but to some degree in la la land. But in any case, we're able to do this where you're not experiencing pain. There's kind of local numbing that's happening in the areas that we're doing. And so it's a comfortable process as that goes. When thinking about the actual few days before and after the procedure, there's a few things that we like to do to really set ourselves up for success. So typically I'll do another pre-visit a week or two before the procedure to just review our goals and go over that again to make sure that both of us are perfectly in line and comfortable with what we're doing. I'll usually send the pre-op medications, which is usually going to be an oral antibiotic, a pain med, which some people do and some people don't end up needing, some anti-inflammatory medications, and that way you have that in advance. There's other things that are helpful to have, such as some supplements that help minimize the bruising, and we like you to have usually some kind of ice packs at home. So usually having that set up in advance is very useful. Most patients then need to plan for going home that night, having a loved one or somebody with them is very helpful. And then typically patients do have the option of staying in an aftercare facility if they want. But in any case, I see you the next morning and we have a little wrap around the head. I kind of say that my patients sometimes look like a Q-tip that day. And there's some drains that we have in that help minimize the swelling and the bruising. And I take the wrap off the next morning. So it would be wise to have somebody available to help kind of accompany you, I think, that night and certainly the next day. Most people are able to do their activities of daily living, within a day or two after that. Let's discuss the risks of the revitalized facelifting procedure, because I think it's very important to understand what are the possibilities before going into it. So I'm going to go in order of the top 3 risks with this procedure. Number 1 is going to be that the healing and swelling takes longer than the average or the majority of patients. We have a lot of tools about how to minimize that, mainly putting a drain in and using techniques that we mentioned, but that's still going to be a bit longer. Risk number 2 is having what's called a hematoma. This is a bruise or a collection of blood that happens after the procedure. And this happens in about 8% of patients in general. And it just means that the recovery is a bit longer in those cases. But I use a drain, again, to minimize that from happening. And we have someone available 24 hours if we feel like there's excessive bleeding, which I've never had. The next risk is really that you're not going to have perfectly smooth and tight skin. And so, we generally say that we can kind of improve things, I'd say about 75% in terms of, the looseness here, the jowls. But my goals, as I always think about, are safety and looking natural and getting the most robust result that's possible under that umbrella. And so with that in mind, I'm not going to overpull and overstretch. And so people need to be aware that there will still be some looseness and some laxity. Occasionally, there's a little puckers, as well that might be visible underneath the skin. Very rarely do I need to do a little touch up to kind of minimize that. But in general, the revitalized lift minimizes having any kind of contour irregularities and puckers because of that deep plane approach, which I'm very proud of. Let's talk about what to expect in the healing process. One of the main questions I get from patients is like, how much is this going to hurt? How painful is it? And I and my patients have been, in general, very pleasantly surprised about the pain level, which is really not that much with a facelift because this facelift is on the periphery of the face, not in the center, more kind of, delicate area, if you will. And the revitalized lift also uses kind of blunt dissection type of techniques where we're not doing a lot of cutting as other facelifts are doing. And so I think patients do recover quicker as well as having a bit less pain. Most of the time, I do prescribe some prescription pain medications that patients use the day of and usually a day after, I'd say on average. But everyone's pain tolerances are different, and we'll work to make sure that you're comfortable after the procedure. Now, what to expect in terms of planning and healing? Well, in the immediate week after, we like you not to do any bathing where you're getting kind of tap water on the incisions for that week. Usually, showering from the neck down is okay, and cleaning with saline or bottled water is helpful. Depending if you've had your eyes done with it, if it's just the neck, most people can drive within 2 or 3 days and can use the computer and be on the phone and do kind of a productive type of activities when it's just the facelift. But the obvious bruising and swelling is typically going to be for about 2.5 to 3 weeks. Now, the nice part is that bruising and swelling with the revitalized facelift is really on the periphery of the face, not in the center, which is much harder to hide. So women particularly have a much easier time. The hair covers, the ear incisions and to some degree the neck, which you can also use kind of a turtleneck and scarves and other things to help kind of, hide that immediate bruising. But you are going to have noticeable issues, like I said, for on average 2.5 to 3 weeks. But what about how long it takes to actually look, great? Let's say you have a wedding to go to or an important event. Usually you want to give yourself a 2.5 to 3 month buffer. And the face is still continuing to heal and kind of look and feel better over the course of the whole year. But the majority of the kind of healing that others might notice really improves in that first few weeks, in that first 2-3 months. How about activities? Well, we don't want you doing strenuous activities like yoga or, weightlifting for about 2 weeks after the procedure. Normal activities of daily living, like I said, like driving, if you feel comfortable from a vision standpoint, getting around the house, doing your activities of daily living, those are generally pretty straightforward, and you're able to do that, within a few days after the procedure. I'd like to thank you for taking the time to listen to what hopefully wasn't too long-winded of an informational video. My goal was to answer some of the commonly asked questions that I get and make you more informed to make a decision about how to achieve your rejuvenation goals. Next steps, if you like to get more information, would be to check out our website. You can also call our office and schedule either a virtual or in-person consultation so we can talk further.